Your pediatrician carefully tracks your baby's head size at every visit until age 2. Then, suddenly, it stops. But here's what most parents don't realize. That change doesn't happen because head growth stops mattering. It's because the medical guidelines stop requiring it at 24 months. And that's a problem. Because brain development continues well into adulthood, and research shows this gap can cause doctors to miss children who need early help. Head growth still matters after age 2. By age 5, your child's brain reaches about 90% of its adult size, not by age 2. White matter, the brain's communication wiring, continues developing through the school years. When growth tracking stopped, key warning signs were missed. Children whose head circumference crossed 2 major percentile lines, either up or down between ages 2 and 5, had 8.5 times higher risk of undiagnosed learning disabilities and 6 times higher rates of ADHD diagnoses by age 7. So why did we stop measuring? Not because it wasn't important, but because large health systems decided it wasn't cost-effective. The science disagrees. When we stop tracking head growth, we can miss conditions that are both identifiable and treatable. If a child's head grows too quickly, that may point to benign external hydrocephalus, a condition where fluid builds up around the brain. Without ongoing measurement, up to 40% of cases go undiagnosed. On the other hand, if a child's head growth slows down or plateaus, that can signal nutritional deficiencies, metabolic issues, or even toxin exposure. In one long-term study, 3.4% of children had concerning patterns after age 2 that led to treatable diagnoses, hypothyroidism, and nutrient deficiencies. Every one of those cases would have been missed under current guidelines. The at-home monitoring protocol, since doctors no longer track this after age 2, parents can step in with simple at-home monitoring. All you need is a flexible measuring tape and a WHO growth chart that goes up to age 5. To measure correctly, wrap the tape around the largest part of the head, just above the eyebrows and ears and across the back where the head sticks out most. Pull the tape snug, measure 3 times, and record the largest number. Here's what to track. From ages 2 to 3, measure every 3 months. From 3 to 5, measure every 6 months. If your child's measurements cross 2 percentile lines, either up or down, within 6 months, that's your cue to call your doctor. If the curve is steady and smooth, that's a healthy growth pattern. For rapid head growth, ask for a developmental assessment and possible imaging. For slowed or stalled growth, request a thyroid panel and nutritional evaluation. Medical guidelines are designed for efficiency, not perfection. And when it comes to your child's brain development, that gap matters. Remember, a small change on a chart can reveal a big story about development. Stay curious, stay observant, and don't be afraid to ask for more than the minimum.